Hello instructors. Here is the project plan presentation for Team 2. Our project is the pre- and post-operative instructions. All patients who are going to have procedures or are recovering from surgeries would like to have a doctor standing by 24/7 to provide guidance and answer questions. However, this kind of care is unlikely to happen for most of us, no matter how good your insurance is. A published study in the journal Annals of Internal Medicine showed that half of the patients made significant errors in 2 months after being discharged from hospitals. In an interview by Kaiser Health News, Don Goldman, the Chief Medical and Scientific Officer at the Institute of Healthcare Improvement, said the episodic care at different places at different times is not designed to keep the overall safety of the patients in mind. That is to say, the variety of providers, such as urgent cares and pharmacies, that patients may visit after hospitalization or procedures may cause inconformity since they may not be very familiar with the patient's situation. Apparently, if a platform can bridge between physicians and patients to guide patients with home healthcare, will help to avoid some errors. The good news is that, with the developments of health informatics and technologies, websites and applications are now being developed to provide personalized healthcare. While these platforms cannot replace real office visits or hospital care, they are indeed helping patients with conditions that can be handled by patients themselves with proper instructions. Hospitals and care facilities already started to use apps such as SeamlessMD, TabCloud, and Track My Recovery to support patients through preparation for and recovery from hospitalization or surgeries. In this project, we will mimic this kind of platforms and develop a web application to provide patients with care instructions. On our webpage, providers have retrievable documents of procedure instructions. They will be displayed for their patients who are undergoing those procedures. For demo purpose, we will include 5 instruction sets: hernia repair, bone grafts, biopsy, appendectomy, and coronary artery bypass grafts. And we will consider at least 10 SNOMED codes, as shown here. Codes in orange boxes are parent codes, while those in yellow boxes are child codes. Both physicians or providers and patients can log in our platform. When a provider decides to conduct a procedure for a patient, he or she can relate this information to the procedure. Once the patient logs in later, the system will remind him, "Hey, you have an upcoming procedure," and provide preparation instructions. Or, if the patient has been recently discharged from the hospital, his physician can also assign post-operative instruction on our platform. At the same time, we have a message channel. From there, patients can leave message and let their physician know that how is everything going. The app will facilitate improved engagement between patients and their care team and enhance the patient's quality of life, thus reducing costly readmissions and post-operative care. We will first spend time on understanding our product requirements by conducting product research. Then, we will be focusing on the UI and UX aspect by creating wireframes. A technical spec will also be written to access the engineering effort. After the research is done, we will separate our engineering resource to front-end and back-end teams. Front-end will be working on displaying the patient login portal, as well as the search results, while the back-end team will be building up the backbone of the app, including the API connections, as well as deploying to Kubernetes. Last, the whole team will spend time on manually testing the front-end before the product is delivered. This is the end of our presentation. Thank you for your time.